Now I come to the next speaker. It's St-Amand from Health Canada. She is since 2015 head of the National Biomonitoring Program, and she made her master's degree in toxicology, joined 2005 Health Canada, and is very interested in developing tools to interpret populational levels, concentrations, and in chemical risk assessment. She's also the chair of the International Biomonitoring Network and the interim co-chair of the newly founded i-HBM, which is a newly created working group on biomonitoring guidance values under the International Society of Exposure Sciences. Thank you very much. She's there, yes. Everything works fine.
Hi, everyone. Thank you for inviting me to present today. I will be sharing my presentation.
We can see you and hear you, okay.
Okay. So I will try my best today to summarize in less than 10 minutes more than 10 years of Canadian experience and approach on developing and using biomonitoring guidance values. I will present our story in a timeline and give you a quick overview of some of the most meaningful milestones over the years. So our story starts in 2007 with Doug Haynes, then director at Health Canada and founder of the National Biomonitoring Program. He is a key character in the story as he shaped our program with a very clear vision that lasted over a decade. Although he retired in 2016, we're still using his strategic orientations. Many of you know him as he's now an advisor on HBM for EU. So in 2007, Doug was able to secure the funding and get management buy-in in order to include a biomonitoring component under a new Statistics Canada population survey called the Canadian Health Measures Survey, which started with its first cycle in 2007. Since then, the survey has been collecting information and samples from 30,000 Canadians across 80 sites in Canada. A chemical list was developed based on consultation with stakeholders and programs, which over the years yielded more than 250 chemicals measured in blood, urine, hair, tap water, and indoor air. At around the same time, in 2007, a new concept was being developed by Sean Hayes from Summit Toxicology on the interpretation of biomonitoring data. This concept was called the biomonitoring equivalent, which meant a concentration of biomarker in blood or urine that is consistent with existing exposure guidance or reference values, such as RFDs or TDI. This approach became a game changer in our story when it was published in Regulatory Toxicology and Pharmacology in 2007. In 2008, a workshop was organized in Estes Park in Colorado with experts in pharmacokinetics, risk assessment, medical ethics, and risk communication from a broad range of government, academic, and industrial backgrounds. Among the meeting's objectives were to develop and publish guidelines for the derivation of biomonitoring equivalent and also for guidelines for the communication of biomonitoring equivalents. Both papers shown here were published in 2008 by Sean Hayes and Judy Lequin. From 2008 to 2011, under a 3-year contract with Health Canada, Summit Toxicology developed BEs for 13 chemicals in collaboration with scientists at Health Canada. The funding for those contracts came from Canada's Chemicals Management Plan. All of the BEs developed have been published in Regulatory Toxicology and Pharmacology, a peer-reviewed journal. During the same period, the German Biomonitoring Commission hired Summit Toxicology to attend one of their biannual meetings to consult with them on the derivation of BEs and HBM1 values. A paper outlining their collaboration and the similarities in both approaches was published in 2011. These concepts are also similar to the HBM guidance value that were just presented by Greet. So now In 2012, Health Canada formed the Biomonitoring Equivalent Working Group under the Task Force for Scientific Risk Assessment, with the goal of nominating and selecting chemicals and reviewing BE derivations. Nomination criteria included chemicals which were measured and detected in the CHMS and had Health Canada exposure guidance values such as TDIs or ADIs. Over this period, another dozen of BEs were developed and published. The second goal was to come to a common understanding on how these BEs will ultimately be used in risk assessment at Health Canada and present this approach to the task force and get approval. At this time also, I was hired as a co-chair for this working group with Andy Nong, a computational toxicologist. And over the next 3 years, we worked with risk assessors from various programs at Health Canada to draft a report to outline this concept and how it was intended to be applied in a risk context at Health Canada. And this report was finally approved by the task force and is now available online. This was an important milestone. We also tested this approach and published the results in 2014, which consisted in comparing BEs with CHMS data and calculating hazard quotient. So hazard quotient is basically the concentration of a biomarker over a BE, and substances are prioritized or they're flagged for risk assessment or risk management follow-up when their HQ value is above 1. It is really just a measure of an exceedance of a biomonitoring equivalent. At that point, we were able to flag 2 substances, inorganic arsenic and cadmium. Now, another important milestone for us occurred in 2016 when Health Canada Risk Assessment published the science-based approach document called the Biomonitoring-Based Approach. This was the first quantitative risk assessment conducted with an internal dose, meaning a biomarker concentration microgram per liter in blood, rather than using a traditional external dose in milligram per kilogram per day. In 2019, my group published an update on the analysis of the population level data from the CHMS comparing with the BE value. So this was an update from what was done in 2014. In this exercise, we added new substances that were not measured previously or substances that had been measured but for which there was no BE developed at that time. We also updated BE value based on new exposure guidance values such as new TDIs or ADI recently adopted. We used the same approach. We calculated hazard quotient, and at this time we flagged more substances for follow-up. And so you can see here the list of substances that we were able to flag, and this is a graph showing the hazard quotient and the different substances, and those above the hazard quotient are the ones that we are flagging. And so these results were flagged, and they were communicated internally to the ongoing process of prioritization activity that contributes to the identification of risk assessment priorities for chemicals at Health Canada, called IRAP. And generally, for a substance to be identified as a priority for risk assessment, the process would identify the presence of both a hazard and a significant potential for exposure in Canada. And so, again, this represented an important milestone for our program because we were able to feed some important information to this process. And we recognize that this approach has many limitations, including the lack of BE or other screening values or guidance values for all chemicals measured in CHMS. There is also the confidence in guidance values that varies. And also we recognize that this represents single exposure analysis and does not address real-life multiple exposure. So this brings us to 2020. And this is when we form a new working group under the International Society of the Exposure Science. And the working group hopes to address the harmonization of biomonitoring guidance values. Shoji Nakayama from Japan is currently chairing this new working group. And as a starting point, We created a database for existing published values. So far the database counts 375 BE value that represents 76 biomarkers for 62 chemicals, 41 HBM1 value, 18 HBM2, representing 24 chemicals, 405 RV95. And it's available online. It's still work in progress. It's being reviewed. So we hope that in the future we continue to create tools to help interpret biomonitoring data and updating this database over the years, including new HBM values being published from various organizations, including both the German HBM Commission and the HBM for EU. And we think sharing this wealth of information widely and making it available will also improve our understanding and our use of biomonitoring data. Thank you very much for your attention today.